In March 1938, concerns were expressed about the cruel dental methods used to take out the teeth of people who could not afford private dental care. These people could do no better than to go to Kingston Public Hospital. The mayor of Kingston, Oswald Anderson, speaking to the Corporation Council, provided a report on the horrifying conditions of dental services at KPH. He described terrified people shivering in an antechamber as they waited their turn to be tortured. The mayor was greatly disturbed at the lack of preventative care. So, if anyone came in with an abscess or tooth decay or other dental conditions, no follow-up dental treatment was provided to ease their pain. Extraction was the only option. Mayor Anderson visited KPH to witness the ordeal. So, with first-hand knowledge, he saw that dentists made no prior efforts to determine if a tooth could be saved. Instead, Anderson was alarmed that the only option was extraction, and the only extraction method dentists used was the primitive way of yanking out teeth without any anesthetic. After the brutal extraction, patients were given a black mug with potash solution. They put some in their mouth, gargled the contents, and spit it out. Then they placed that mug back on the table for the next patient to wash out their mouth with the same solution that should, by now, contain the blood remnants of the previous users of the mug. The mayor claimed angrily that the director of medical services should know about the savage dental treatment, but he said nothing. The council made a resolution to improve dental conditions, to give proper care and examination to the needy, to give anesthetic when extracting tooth, and to implement sanitary measures.